Welcome back. Researchers and health professionals have been celebrating after the World Health Organization approved the widespread use of the world's first malaria vaccine. More than 260,000 children under 5 die from malaria each year in sub-Saharan Africa. Now, let's discuss this further. We're joined via Zoom by Dr. Simon Kariuki, head of the Malaria Research Program at the Center for Global Health Research. Thank you so much for your time this afternoon, sir.
Thank you very much, and thank you for having me.
Dr. Kariuki, please can you talk to us about what this announcement by the World Health Organization means for the fight against malaria? Just how significant is this on the face of so many people still dying from malaria every year, especially children?
This is very, very significant. We have proven tools for prevention and control of malaria, such as the artemisinin-based combination therapies. We have insecticides, and we have bed nets. And all these tools have seen, since they became approved, we have seen a significant reduction in the number of children dying or getting malaria. Now, the problem is that we have started seeing mosquitoes becoming resistant to insecticides which are used for spraying houses, and parasites becoming resistant to the artemisinin-based combination therapies, for example, in Southeast Asia. And now we have a report from northern Uganda that there's delayed clearance of parasites when children are treated with these drugs. So it's a high time we needed a new tool. And the approval by WHO for the RTSS malaria vaccine, I think, will go a long way in adding a new tool to the existing arsenal of tools that we use for the control of malaria. So this is very timely, and it will go a long way in the fight against malaria.
Now, Dr. Kariuki, how effective and safe is this vaccine? And does it probably speak to just how long it has taken for the continent to get to this point?
This vaccine has been tested in several phases. And as you are right, it has taken over 30 years from development of this vaccine and testing it up to this time when it's being approved for wide-scale use by WHO. This vaccine has been, at least 80,000 children have received the vaccine, and close to 3.2 million children have already received the vaccine, but close to 80,000 have received the first dose. So this vaccine has been shown to be safe in all the phases, and it's efficacious. And so far, we haven't experienced any challenges with its safety. And it underwent very stringent regulatory review, with the results which were obtained through all those trials by the European Medicine Agency and by experts at the WHO. And they have given it a green light that is a safe and efficacious vaccine for use in young African children.
I mean, perhaps one of the things that COVID-19 pandemic has done for many people is show how expensive vaccines are. So talk to me about the cost implications and who essentially will be paying for these vaccinations, particularly if you look at the region and where most people are being affected.
That's a very good question, because at the time when we started these trials in sub-Saharan Africa, the African scientists asked that same question: will this vaccine be affordable because it is meant to be deployed in countries where malaria is endemic and in poor countries where malaria affects most people. And we were assured by the manufacturer that the pricing will be very reasonable and it will be affordable to people in sub-Saharan Africa. Now that it has been approved for use, for wide-scale use in sub-Saharan Africa, the next steps will be to look at financing of how these countries will be able to finance, whether it's through Gavi or whether it's international donors or whether it's through country-owned processes and mechanisms. Those are going to be the next steps. But we have the assurance that this vaccine will be made available at a price that is reasonable, and it will reach the children who need it most in sub-Saharan Africa, and the price will not be a hindrance.
Now, you've spoken about the efficacy of this vaccination and just seeing the improvements on some of those trials that you've conducted. Do we know then when the vaccine will be made available, for all populations?
That will depend on different countries because they have to look at the mechanisms where to deploy them. It's in many countries, malaria is not all over the country. So there might be some regions where in a country where they will want to deploy the vaccine. But the overriding factor will be where it's needed most. And those are the discussions that are going to go on for the next couple of months. And we hope that the vaccine will be introduced as soon as possible in these countries, because from the evaluation that we have done in Malawi, Kenya, and Ghana, we have seen that there's a very high demand for the vaccine. These people who suffer from malaria, those families whose children suffer from malaria, have been asking for a vaccine for all these years. And now that we have one, the uptake has been so good, very good during the evaluation, and we think even when it's deployed, the uptake will also be very high. And therefore, countries will make every effort to make the vaccine available in areas where it's needed as soon as possible.
Just as a final question, Doctor, how has COVID-19, affected just the work that goes into combating malaria? I mean, now it'll probably get easier as the vaccinations start getting rolled out, particularly in those countries that you have mentioned, including sub-Saharan Africa. How significant has COVID-19 impacted or made it even more severe, to be fighting malaria simultaneously?
Well, when COVID-19 hit the sub-Saharan Africa in early last year, one of the fears was that it was going to impact negatively on the efforts to combat malaria. But that did not happen, luckily. And we have continued with the programs for prevention and control of malaria. The funding mostly has been channeled to, but the available funding, most of it from donor agencies, have been diverted to COVID-19. But so far, we haven't seen any drop in the programs that target the combating malaria in sub-Saharan Africa. Yes, there have been challenges, but those challenges have not resulted in an upsurge in the number of malaria cases or uptake of malaria prevention tools.
All right, fantastic. Thank you so much for your time, sir, this afternoon with us.
Okay, thank you very much.
Thank you. Dr. Simon Kariuki there, obviously commenting about the world's first malaria vaccine that was recently approved by the World Health Organization.